Hi everyone, my name is Ephraim. I'm a respiratory therapist and I work at the hospital. Currently, the world is facing severe disruptions due to this pandemic disease, coronavirus or COVID-19. This virus rapidly spread all over the world. It led to a high rate of mortality and it became a great challenge to healthcare professionals. The COVID 19 outbreak is changing life for all of us. You may feel stressed, anxious, worried, or frustrated due to this crisis. I deeply understand the anxiety and the stress everyone has. This virus is affecting about 213 countries and territories around the world. Anyone who got infected by this virus can have mild to serious symptoms, especially older adults and others who have severe underlying medical conditions like heart or lungs or could be diabetes problem seem to be at higher risk for developing very serious complications of the coronavirus illness. The common symptoms so far reported are cough, the difficulty of breathing, fever, severe headaches with chills, new loss of taste or smell, and vomiting and diarrhea. Those are the very common symptoms reported so far. After being diagnosed positive for COVID 19 at the doctor's office or at the clinic or somewhere else, they might send you home to take care by yourself for a different reason. It could be due to there is no advanced medical service in your area, or you presented with mild symptoms at the time of the test, or it could be due to financial issues like no medical insurance. Anyhow, I would like to share very important information for individuals who got tested positive for COVID 19 but not hospitalized. Such a simple thing they can do at home that might help them to recover from COVID 19. This technique or maneuver is called proning, prone position. Some of you might already know or heard about it, but I will explain exactly what proning is and how it works. As a respiratory therapist, I work on the front line of the coronavirus pandemic, and I have seen success treating patients using this simple technique called proning. Of course, in addition to the other types of care they receive. This term basically means placing patient flat on their belly with their chest and face down rather than on their back. It requires little or no special equipment, especially for non-intubated patients. And this technique helps critically ill patients to avoid being put on a breathing machine called mechanical ventilator. COVID-19 patients often die of ARDS, acute respiratory distress syndrome, which is a life-threatening complications of coronavirus infection. This same syndrome also kills patients who have pneumonia, pulmonary edema, sepsis, and influenza. Well, proning is not a new technique for us. About 7 years ago, French doctors achieved success treating intubated patients who have ARDS with this same technique. After that, many hospitals in USA have been placing ventilated ARDS patients on their stomach. It's just opening up part of the lungs. And we have seen remarkable improvements. This technique now considered to be a safe and simple method to improve oxygen saturation in the blood, to increase lung volumes, reduce the amount of lung collapse, and also it helps to facilitate drainage of secretions from the lungs or improve secretion clearance from the lungs. The ventilated patients, COVID-19 or ARDS patients who are on a mechanical ventilator, they stay on the prone position for 16 hours a day. They can tolerate it well because they are heavily sedated and some of them are paralyzed too. Placing them in this position helps respiration because getting more oxygen into the blood is easier in this position. It's a function of anatomy, as the human body has more lung tissues and pulmonary vessels in the back of our body than on the front. The coronavirus infection also causes abnormal fluids and secretions to pull toward the lower part of the lungs which have more lung tissues and located in our back. When patients are laying flat on the prone position, gravity helps to pull secretions downward to the upper part of the lungs. Now, the good lungs, the less affected lungs, the lungs with more lung tissues are on the top. We did use this same technique for some COVID-19 patients who are not in the critical care units to reduce the amount of intubation and avoid being put on a mechanical ventilator. This is called early self-proning. It's just trying to help them open up part of their lungs that were not open before. Since the placing a non-intubated patients flat on their belly for 16 hours is not comfortable for them, we try to instruct them and encourage them to spend at least 4 hours on the prone position, and they can take break like by turning to their side or left or to their back, and then back again to the prone position for another 4 hours. We repeat that until they improve their oxygen saturation. And I have seen remarkable improvements. I have seen patients, some COVID-19 patients, able to recover from the infection and discharged from the hospital without being placed on a mechanical ventilator. My point is, you can use this same technique, early self-proning method, at home too. How long you have to stay in the prone position really varies from person to person. It depends on whether you're comfortable enough to fall asleep in that position or not. But try your best, give it a shot. If your symptom doesn't improve or if it gets worse, please call your emergency service or your primary care provider immediately. I would like to mention about one thing though. This method or this technique is not recommended for a pregnant woman or someone who has unstable spine or someone with a pelvic injury or pelvic fracture. Thank you for listening to this message. I hope you find it very important. Please share it with others, and I will see you next time with the updated information. Please stay safe out there.